Before you start another fad diet, we have a different way for you to think about weight loss. Joining us is Dr. Sara Stein. She has written a new book, and I love the title, Obese From The Heart, a Fat Psychiatrist Discloses. Look at that. That's different, Dr. Stein.
Yes, it is.
I mean, you can look at us, obviously, neither one of us is a size 2. Welcome to St. Louis.
Thank you.
This is a completely different approach.
Yes, it is. It's a completely different approach. The question is, why are we struggling with obesity, and why is it getting worse? We're at a point now where 40% of Americans are approaching obesity and 60% or more are overweight.
But the thing I love about your approach is really it's you. Because so many people who talk about weight loss, they're a size 4. And I often look at people and I go, what do you know about my struggles with weight? You've always been tiny.
Or you've lost 20 pounds.
Or you've lost, yeah, exactly.
Right. And so there is a distinction which we have not made yet, which I'm hoping we will, between obesity and between overweight. Overweight is a lifestyle issue. It's thermodynamics. Too many calories in, not enough calories burned. Simple. All of the diet books, all of the nutritional programs, the exercise programs address that well. But obesity is an illness. It comes with chronic inflammation and pain and disordered metabolic pathways, nutritional deficiencies, and altered brain chemistry. And so you can't take somebody and restrict their calories and put them on a treadmill if their body is ill, and their mind and their spirit. And
you have several really good tips that, again, are not what we would normally think about when we talk about weight loss. And one of those is not to think in weeks or months in terms of our weight loss, but to think in years.
Think in terms of years. If you were trying to heal from a major car accident or trauma, you would not expect to be better next week. And so in the case of trying to change your brain chemistry back to the way it naturally is and heal the inflammation in your body and take care of chronic pain, it's going to take years. I started out doing this because I was 155 pounds overweight, and I couldn't figure out what was wrong with me. I couldn't figure out why I, as a psychiatrist with 20,000 patients and 25 years experience, couldn't handle this. I couldn't figure it out. But I also knew that it wasn't because I was lazy. It wasn't because I was a bad person. I couldn't stop eating, and I didn't know why. And I kept getting fatter every year. So I said, well, what if we approach this the way I would approach brain injury? If I had come in having had a major head trauma, how would I approach it? I would approach it on a scale of 2 to 5 years. I would make very minor, gentle changes. And I would keep making those changes day after day after day until it adds up. And I'm steadily lose 2 to 3 pounds a month. I don't even think about it. My first change was just simply switching from lattes to coffee. That was my first change.
There's a lot of sugar in a latte.
I began exercising by being in the bathtub and moving my legs because that was the only way I could do it where it didn't hurt.
And one thing that you talk about too is vitamin deficiency. Now I think about vitamin deficiency when it comes to my skin and my hair, but not my weight.
Very serious vitamin deficiencies. It's interesting that vitamin D deficiency is rampant even in sunny climates. And so vitamin D, which is our sunshine vitamin, is responsible over time for obesity and the development of diabetes, arthritis, dementia, heart disease, kidney disease, if it's deficient for many years. And so you say, yeah, but I live in St. Louis, and even on a snow day we have sun.
Right.
Well, you do, but you're indoors. So it doesn't translate into vitamin D being made or manufactured in your skin. And as a result, that puts us at risk for all of these disorders.
All right. Dr. Stein, thank you very much for joining us.
Thank you, Carol. It's a pleasure.